program here in Tennessee, and then kind of wrap up with some peeks into what we want to do. So for those of you that don't know me, I thought I would take just a couple of moments to share with you my background to make you and the state of Tennessee feel a little more confident about what I'm doing with this program and that I have some background in it. I went through all the basic training for about 20 years, got a couple baccalaureate degrees, one in prosthetics and orthotics, master's degree, doctoral degree, which happens to be with a focus in biomechanics, very relevant to prosthetics and orthotics, and did my requisite training for 3 years, a couple of years in orthotics at Southern Illinois University School of Medicine, and then another year in prosthetics at Connecticut Children's Medical Center. Went on to get ABC certified and then practiced as a prosthetist orthotist for about 8 years in the state of Connecticut and in Texas. And in those private and institutional practices, I managed patients in both prosthetics and orthotics. So I have a little bit of academic background, I have some clinical background, and I've taken that knowledge and training and then applied it into higher education. And so about the last 20 years, I've been working in higher education at the university level, developing curriculum, teaching courses, conducting research, and administering academic programs. And I did that starting out at the University of Texas Southwestern in Dallas, and then up in St. Ambrose University in Iowa. Later on, I went to Georgia Tech and started the first master's degree program in orthotics and prosthetics there. Then I went on to the University of Pittsburgh and developed some of their curriculum in orthotics. And now here I came to ETSU in the state of Tennessee. So what I'd like to do next is to talk a little bit about why we need an education program, particularly in Tennessee. And I want to frame that talking about what I would consider challenges to the O&P profession. Some of these things you're quite aware of, maybe some things might be new. After we talk a little bit about challenges, I'll offer some solutions. And you can imagine, since part of my talk is about ETSU, I believe that one of the solutions would be this new education program. And then I'll talk a little bit about next steps. Okay, so to start with this discussion briefly, what are the challenges to the O&P profession and why might we need another education program in orthotics and prosthetics? Well, there are a lot of reasons, and many of you are experiencing some of those, but I'll try to make it brief. I'll classify this as a workforce shortage. Currently, there are 13 schools in the country that are graduating a little over 250 students a year. But if we look at the workforce demands for practitioners, the number of practitioners that are retiring, how many people will be needed to come into the profession to make up for that demand, and also the incoming number of patients, there are some suggestions that anywhere from 17 to 49% increase in the number of practitioner graduates is needed. So this number of 258 students is not adequate, and we need more students. The exact number of students is a little varied, but we need more practitioners. Another reason for developing a new education program is the expanding patient populations. I know many of you are experiencing this in your clinics, that being an aging population. We're living longer in the United States. Unfortunately, because of technologies, we tend to lead more of a sedentary lifestyle in general. And some of these things have contributed to multiple body systems disorders, such as diabetes, which is becoming at an epidemic rate and continuing to rise. Obesity, some alarming numbers there that I'm presenting, some suggestions that over half the United States may be obese by around 2030. Certainly cardiovascular diseases, those that involve the heart, the circulatory system. I think you know what I'm talking about, in particular vascular diseases and stroke. Well, we know stroke is becoming a leading form of disability. And unfortunately, we're seeing a larger number of people with strokes where they're occurring at a younger age. On top of that, we're seeing increases in the number of people with arthritis and joint disorders. So all of these kind of snippets that I've given you with some statistics point to the fact that we need practitioners that are also knowledgeable on aging and these clinical conditions of certain body systems and their treatments. Some additional problems are that we're seeing an increase in the underserved populations. People in the United States are experiencing a greater income divide. More people having difficulty paying for their insurance if they have it. When we look at rural medical care centers, we're seeing a number of hospitals that were community hospitals are closing up because they're struggling to maintain their budgets. And as a result of that, people are having to travel further distances for their care. So rural services are becoming a bit of a problem. And what I'm showing you here are two graphs. The graph on the left is basically a geographical plot of the United States showing the county level prevalence of diabetes. And I just wanted to point out that the Southeast United States is showing, as reflected in this darker color, which would indicate a higher prevalence of diabetes, that there's a region in the Southeast United States where we're experiencing a substantial increase in people with endocrine disorders, managing their blood glucose, diabetes. Similarly, we're seeing problems with stroke, and particularly what's known as the stroke belt. Not talking about a belt around your waist, I'm talking about an epidemiological belt in the Southeast United States. And essentially, if you look at this geographical map, the darker color, which cuts right through Tennessee, if in particular, is where we find the highest incidence of people with stroke. So some of you in the orthotics community might not be surprised that you're seeing a large number of stroke survivors because this is where they reside in the Southeast United States. So the read here is that we need more practitioners in orthotics and prosthetics, particularly in the Southeast United States. In addition to the clinical challenges of a workforce shortage and practitioners being able to provide care to an increasing number of patients, we're also seeing some other interesting trends in terms of the way that we deliver care. And some of you might already be experiencing this. We know that traditional fabrication processes are very time-consuming and labor-intensive. You know, the method of where you're taking a cast by hand, producing a positive model, rectifying it by hand, then thermoforming or laminating it. And some of you may already be doing this, but if those of you who are not, we've also seen rapid advances in the way manufacturing technologies are driven, such as 3D scanning, additive manufacturing. We've seen some new evolving material science. And then the area of artificial intelligence and machine learning is coming into play, particularly with wearable devices that have external motors that move joints. And I'll be talking a little bit more specifically about that in a minute. Let me give you an example of what I mean by these challenges to manufacturing technology, scanning, and digital production. This is an example that I've kind of illustrated, a company known as Weave Wearables. This is a company that provides direct-to-consumer custom molded foot orthoses. And the way that the product is delivered is a patient may go to their website and select from an array of foot orthosis options, and select then to contact the company, who will send them digitally an application that they can download to their phone. They can take a picture of their foot with their phone and basically scan their foot, send the digital file to the company, and then the company will take that digital file of the person's foot, alter it through 3D CAD technology, send the digital image to a production like a 3D printer, and within about 2 weeks, voila, you receive your custom molded foot orthosis. So direct-to-patient marketing and provision of care in orthotics, at least, is starting to occur. And this is something I just want to make you aware of because it's a new market that we'll need to cope with as practitioners. You also probably are experiencing, some of you are experiencing this, where 3D printing technologies are on the rise. For those of you that might not be aware, digital scanner is produced with some type of a handheld object, either a smartphone where you can download the scanning application, such as Comb Scan. And by the way, I don't have any affiliation to these companies. This is just purely informational. So a digital image of the patient's limb is then scanned. It's rendered in a computer program, and it can be modeled and altered through shape modification. And once the final product is satisfactory, it can be sent to a 3D printer, and then the item can be printed and produced and fit to the patient. So this is occurring through some of your practices by augmenting or changing the hand delivery model of fabrication, but it's also occurring through open share. So let me give you an example. Not only are practitioners like yourselves doing 3D printing, but there are also open source or open share technologies for files that can be accessed by patients. So all of these pictures are examples of 3D printed products that patients or consumers have provided for themselves. Anything from spinal orthoses for the torso or neck, to lower extremity orthoses seen in the middle, to upper limb orthoses, even some with articulations. And in the case to the lower right, devices provided for animals to assist them in ambulation. So these are basically technologies that consumers are also toying with and providing for themselves. I don't think the market's going to go away, but it's something that we need to be aware of. And we'll talk about how to cope with that in a minute. In prosthetics, we're also seeing similar implementation of these technologies, creating actual external framed shank prostheses like the one to the left and the one to the middle here, upper limb prostheses, and then, wouldn't you know it, also limb prostheses for animals. So these are also examples where consumers can download a digital file, and if they have availability or access to a 3D printer, they can print the product themselves. To move on to some additional technologies, another emerging idea is what's called human in the loop control. This is emerging in the field of prosthetics, and essentially it's just conjoining a prosthesis that may have embedded sensors that are placed over muscles or nerves, where the patient can then engage their neural control mechanism with an external motor in the prosthesis and cooperatively activate the device. So in this case, a person might be activating their dorsiflexors or their tibialis anterior dorsiflexors or their plantar flexors like the gastrosoleus via an electrode embedded in the socket and tell the prosthetic ankle foot mechanism when to power and push down or to lift the foot up. And then we've also seen these technologies with exoskeletal lower limb devices for people with their limbs intact, such as these HKAFO systems that have been on the market now for the last several years. This is one particular example called Indigo, which you may have heard of, where a person who may not be capable of standing or walking could wear an externally powered device and then be able to walk. One last example before I move on to some solutions is I just came across this recently. You may be aware of this or not. The research community is also getting into the area of prosthetics and orthotics. And this is one particular example by the University of Michigan working cooperatively with other researchers, where they have produced a lower limb prosthesis to be used for research purposes. And they've made essentially an open source leg model where other researchers at universities can go to their website and download files to print and assemble a product to create a lower extremity prosthesis for research purposes. And so this is now becoming available. So essentially, I'm just providing you an overview of some challenges which involve these new emerging technologies to replace our hand fabrication intensive processes, which is kind of interesting. On top of that, probably speaking to the choir here, but I just want to frame the problems for you. We know that we're experiencing shrinking reimbursements and only a modest expansion of the L-code fee schedule. So the repertoire of our capability of billing for services is becoming more limited. And to make matters maybe even more challenging, we're still struggling with a limited body of evidence to justify our reimbursements. So what are we to do with all these challenges? Well, we know that all of this is creating some problems. And so these direct to patient supports tend to be a challenge for us because now we're competing with a new market. We also have access to increasingly capable devices like these 3D printers and scanners, perhaps where we could maybe augment what we do and make it more efficient, although there is a learning curve with new technology. But I think the point that I'm trying to get at here is, despite these challenges, in order for us to survive and perhaps thrive, we need to move beyond a device maker paradigm to more of a clinician paradigm. And somewhere in the process, find evidence to support our outcomes so that we can begin to take more charge of our fee service. So how do we do that? Well, I think one way to do that is we need to update the education of our next generation of clinicians. And some important skills and capabilities of these individuals would be to collaborate with other disciplines, to communicate, obviously maintain the desire to help, to have this systematic or process-oriented approach to the way that we do things. And I'll talk a little bit more about this in a curriculum model that I'm going to propose. Adaptation to change and being able to embrace change is going to be obviously the namesake for our future. Having the capability and maintaining and being curious, very important. And certainly evidence-based practice and collaboration and research. You know, there's a lot of suggested skill sets here for our future generation of clinicians to embrace. How do we do it? Well, we know that in the face of change, we have opportunity to adapt and learn. So I think to sum this up, one solution is for our future graduates to be equipped to deal with change. And I think one of the ways that we can do it, since we're such a small profession and that's fragmented, is we need to be able to reach out to our related professions in medicine, in physical and occupational therapy, in engineering, and move from this device-centric approach of care to this holistic values-based care. Coping with change will probably be the hallmark of our future. So let me kind of move on and we'll talk now about how can we maybe put together an education program to address some of these critical challenges. So at ETSU, East Tennessee State University, we intend to start a Orthotics and Prosthetics Master's Program in 2022, so basically a year from now. The program will be 2 years in length, 70 credit hours, and we'll have a small cohort of only 14 students. So we'll be able to tailor more attention to students rather than some of the other programs which in the United States, which tend to be a bit larger. And I'll tell you a little bit more financially in a minute how we can do that. We intend to have what we call an interprofessional model, where some of our coursework will be shared with physical and occupational therapy, nursing, social work, and even medicine. So the intent here is to take our students' learning so that they can learn from some of their future referral sources while they're students. And this isn't new in medicine or healthcare, but it is a little new to some of the O&P schools. Developing communication skills is a hallmark sign and feature of this education program because because of a lot of reasons, not only communication with patients, but communication with referral sources. And actually, there are a number of investigators in prosthetics and orthotics that identified needs in orthotics and prosthetics education programs. And this came about as being one of the hallmark needs for development across the nation in O&P schools. In terms of other curriculum areas that we intend to focus on, patient-centered care is a big component. I'm not saying we're taking out the fabrication component, which still defines a lot of what we do in orthotics and prosthetics, but I'm talking about replacing a little bit of that intensive fabrication component and adding some additional content on how to manage and evaluate patients. So that would look like courses in clinical diagnostics, how to formulate a treatment plan, determining outcome measures, how to employ outcome measures, and then how to even update the treatment plan as the person's physiology changes. How we intend to do this is what I would call unpacking our core courses. If you look at a lot of traditional O&P education programs, and maybe you have all perhaps experienced this yourself when you were in school, is that orthotic prosthetic core courses tend to overload the student with a lot of required skills and abilities. So you might have taken a course in, let's say, lower extremity orthotics, and you were asked, or currently as a student being asked to take an impression of the patient, to figure out what the patient needs, fabricate the device, fit the device, determine the outcome measures, all of that in one course. And so I believe as an educational program, from a teaching perspective, it's really hard to measure student learning when you have all of those required learning objectives bundled up in one, what I would call super course, kind of like you have a super L code for a patient. We would want to break down our L code billing. We also want to break down our students' learning. So unpacking courses, meaning let's take that course in lower extremity orthotics as an example, and let's break it down into a separate course on theory and how to actually evaluate a patient for a lower extremity orthosis. And then another course in how to actually fabricate the device. And the student may need to learn to do this multiple times. And then third, another course on how to manage a patient using these theories and fabrication processes that they've learned. So instead of taking one course in lower extremity orthotics, the students in our program would take 3 courses that combined would help them learn the skill sets required to manage a patient. I'm going to skip over some of the other content here just so I can move on. So what we're looking at doing is developing our program and housing it on the medical school campus. Here's a picture of our medical school campus. This is the VA Medical Center in the foreground. This is Johnson City Medical Center, Level 1 Trauma Medical Center in the background. And in between these 2 medical centers is going to be our building. We call it Building 2, where we will occupy the space with physical therapy, occupational therapy, and O&P. And the idea is, in a shared space, we can also share some curriculum with our related programs. And we are intending to do that. And we've already been developing curricula with PT and OT to share. So I just wanted to show you a brief schematic of how we intend to lay out our facilities. We're just starting the fabrication, or excuse me, the construction process of this building. This is the first floor of Building 2. On the left here is where the occupational therapy program will be. And on the right is where we'll have our orthotics and prosthetics program. And we'll have a lecture and clinical area to house 14 students and 7 patient models that they will treat. And we'll have a fabrication and assembly area with ovens and sewing machines and all the requisite equipment. We'll have a machine room, and then we'll have an area where students can learn how to do 3D modeling and printing, as well as the requisite offices and lots of storage space. So I just wanted to show you this image that we're launching construction of facilities, and we will have modern facilities to teach all the requisite orthotic and prosthetic, clinical, fabrication, and other instruction. So our model of training and education is not new in academia, but it's a little bit new in orthotics and prosthetics, where we want to weave together not only clinical practice, training, and education and the fabrication elements, but we also are going to engage students in faculty-directed research. So the faculty will generate clinically relevant research questions, and then the students will spend a year and a half working with the faculty in the O&P program and with other PhDs that are trained in research to conduct actual investigation. So let me begin, what am I trying to say? Let me start wrapping this up by giving you a few highlights here. So our program, what will make us unique, we believe, compared to other programs in the country, is we're going to create an intensive, clinically oriented curriculum. And the students will start with that with a cadaver-based anatomy course. And we'll have it, that course will be taught by physicians, therapists, and PhD anatomists. So that'll be a nice start for them. Because we're based on the medical school campus and because we're sharing curriculum with PT and OT, there's a chance that simply by geography that we'll be able to share more curriculum and collaborate. Not many schools in O&P actually have the luxury of working with PT, OT, and physicians in the same building. We're developing a surgical innovation center where we will also be working with other physicians on training them in amputation techniques. And certainly we'll have the orthotics and prosthetics students involved in that. And like I mentioned about unpacking our courses. One last couple of tidbits. We will be offering students that are from these other adjacent states, if they apply to our program, they can come here and have in-state tuition, so they can get a substantial reduction in the costs of their care, of their learning through these 11 states. So we're hoping to attract out-of-state students as well as in-state students to come. Couple of last bits is our next steps is we're going to be hiring faculty and staff. So this is a shout out to the O&P community that we're looking at hiring 2 ABC certified CPOs with master's degrees and a laboratory technician with extensive O&P experience. So we'll have announcements coming out soon. And in case you want to reach out to me, I'll give you my contact information at the end. I'm also a shout out to the community asking if you would consider collaborating with us by perhaps participating as a clinical internship site when our students will begin those internships in 2 years from now. So I may be reaching out to some of you asking to participate. And then also consider serving as a guest instructor in our curriculum starting next year. So there's my references, and this last slide, I'll just give you my contact information in case you would like to reach out to me with more with questions or if you want more information. So thank you very much for your attention, and appreciate it, particularly in your busy schedules during the lunch hour.
Hey, Chris, Jerry's in the other room. He's getting set up. So if anybody wants to ask Chris questions, go right ahead. We are doing general sessions today, so there isn't anything concurrent. So if you have specific questions for him, please go ahead and do that right now. And then when you're finished, we will head over to Jerry's room where he's getting set up over there. So nobody be shy.
Well, I understand after having attended this meeting and many other meetings, you end up with getting the virtual platform fatigue. So I understand they're asking questions may be a bit of a challenge, particularly at this stage.
Hey, Chris.
Maybe, oh, sorry, go ahead.
I was just going to say, I don't know if you noticed that there was Tom Karolewski asked you a question in the comments. I don't know if you saw that or not.
Oh, I'm sorry, I did not have access to the comments.
I can read it out to you.
Could you please?
Yeah, he just asked if you had read the book, Demographics and Demand for Higher Education.
Dave,
author-
I'm unmuted, Dave, if you want me to say it out loud.
Go for it, Tom. I don't need to be your spokesperson.
Hi, Chris. It's Tom, as you know. I was just giving you a reference. You talked about how we're lacking graduates, and you know that I'm part of NCOPE, so I know a lot of the data that's coming out. I happen to read a very interesting book by Nathan Grawe, Grawe, and the title is Demographics and Demand for Higher Education. And the author points out that from now till 2030, all the universities may see a tremendous drop in enrollment because in 2006 we had a recession and people stopped having kids. So one of the things we're looking at is how to market better so that we don't suffer as much from the drop in of population. So I'll mute myself again.
Yeah, thank you very much, Tom, for that reference. Yes, that certainly is a challenge, not only with the recession, but I think we're also seeing in the upcoming, not only the upcoming 10 years from now, but the next generation 20 years from now, with the reduction in the birth rate, we're seeing less people in schools. So we're likely going to see kind of a double whammy here with reductions in enrollments for the near and longer term future. So that means, I think, as Tom mentioned, being more creative on our marketing strategies and perhaps reaching out to students even at younger age, sharing with them what a field of O&P can offer. So thanks for sharing that, Tom.
My pleasure.
So we are looking at constructing our facilities, and the facilities should be completed right around a month or so before start of our program. What we're hoping to do is to send out an announcement to the greater community in the region, the O&P community that is in the region, our neighboring states, including Tennessee, and be on the lookout for announcements and invitations for you to come out our way for maybe a little short time in the mountains so that we can unveil our new facilities and share with you our exciting developments here.
Okay. All right. You ready to go hang out with Dr. Stark for a little bit? Get all jazzed up on emotional intelligence. It's wine o'clock over in the other room, so I'm going over there. Thanks, Chris. That was great. And this is recorded, so this is going to go on demand, and that will be up on Monday for anybody that needs to watch it again for extra credit.
Extra credit. Wow.
Extra credit. You get 10 credits if you watch it 10 times. And if you refer a friend, you get a free French fries at McDonald's. Okay, we're heading over to Jerry's. Come on, Chris, let's go.
All right. Thank you.